There are many people that are affected by opioid abuse every single day. In fact, 130 Americans die on an average day. There are three waves of the opioid abuse that has happened in the past few decades. The first wave being in 1991, the second wave being in 2010, and the third wave being in 2013. So, my question for you is the U.S. doing enough to curb opioid abuse? And my answer is absolutely not. And there are three reasons why. First, there's a lack of knowledge. Second, they're taking the wrong approach. And third, there's a lack of data. So, Rohanit Sain, he wrote the article, How Should Medical Education Better Prepare Physicians for Opioid Prescribing? And he stated that opioid prescribing is a key contributing factor to opioid abuse. He also stated that integrated clinical-based care teaching and longitudinal application would also be better for in the medical colleges to teach them ethics and how they should prescribe it, because it's a very known thing that physicians will just prescribe it and not care. Maybe the symptoms aren't legit enough to have it, so they just prescribe it. Also, Vanderbilt University had an article published on PubMed, December 2013-2018, and he said medical school curricula does not devote substantial time to addiction, education, and many physicians lack knowledge regarding assessment and treatment of opioid addiction. So the second reason is wrong approach. According to Matt Quinn with the governing, he stated that in July 2017, public officials in the U.S. have been less willing to do medical-assisted treatment, where the physician, they'll pretty much inject the people, the person with the opioids to help curb it when they're having a dependence on it. Also, February 2019, Matt Devitt wrote an article, Research Shows Nation's Opioid Epidemic is Far From Over. And he wrote that physicians should have an open and non-judgmental conversation with patients because it can positively influence them to seek out treatment. He also stated that it's important to note that patients with substance abuse disorders often suffer from significant stigma and have had negative experiences with healthcare systems. So by changing the way that the physicians look at the people and the way that they handle the situation, it could facilitate incredible report leading to interest in treatment. So the lack in data in rural areas. John Hopkins came out with an article called Rural Communities in Crisis, a critical count to save lives during the opioid epidemic. The article stated that the rural community in the U.S. put in a variety of programs, but a lot of times the communities don't know how many people need help and that they're going through it. So if they don't know who's going through it, how many people, they can't really offer the help that's needed if you don't know. The National Rural Health Association policy brief came out with a letter on treating the rural opioid epidemic, and the summary stated multiple barriers that affected the treatment, and that is the decay of mental health and substance abuse resources, a lack of required coordinating of regional resources, a lack of support of rural physicians providing the substance abuse treatment, admin barriers that are most effective for treating the opioid abuse treatment, and shortages of the rural physician that provide the medication-assisted treatment. And there's also there's a documentary on Netflix of a man that his son was killed over opioids during a drug deal, and they found out that the son, he was killed, and the lady that was giving the drugs out, she was a physician, and she had lines of people She was just giving it to everyone because she knew she could make like cash money and would be hidden. And so the dad, he fought to like find answers and to make like an impact on like ending opioid abuse. So to answer the question, is the U.S. doing enough to help curb opioid abuse? And that answer is still no, because with a lack of knowledge, taking the wrong approach, and the lack of data, it won't change. Thank you.